Hi, friends. I don't look sick now, but I was diagnosed with a rare lung disease at the young age of 27. My name is Niki Plomaritis, and I've been living with pulmonary alveolar proteinosis going on 28 years now. And it's been quite the harrowing journey, I have to say. I'm here to tell you that there is a light at the end of the tunnel, and there is hope for having a quality life. With the PAP Foundation and patients like me who can share their journey to spread the knowledge to others, there's a support network available to help answer all your questions or even just to talk about your day. PAP, to make it simple, is an autoimmune disease that inhibits breathing due to surfactants that build up into the alveoli where oxygenation happens, that goes to your bloodstream. It affects 7 in 1 million people. You can find more information in the PAP Foundation website, papfoundation.org. So my life before diagnosis was about adventure and exploration. And I was an athlete who played organized sports from 8 to 34 years of age. I started noticing a difference in shortness of breath and coughing during activities. So after diagnosis, I continued until I just couldn't anymore. An example is I had come back from a backpacking climb in the Rockies, fatigued with the exertion I made on my heart and my body. It lasted 6 months. And I went to the doctor and he said, Niki, there's just some things you can't do anymore, like going to 10,000 feet. So I stopped climbing until that was my last climb, actually, in 1995, I think it was. Until 2018, a couple of years ago, I went back again, and it was absolutely glorious. Back in the early 1993, when I was diagnosed, I couldn't find a lot of information about my disease, much less a doctor who had been informed of it or had any hands-on experience. I was diagnosed via an open lung biopsy, which is very invasive compared to what they're doing now, and it's still in clinical research. It's a diagnosis method using a blood test, which has 100% specific for diagnosis. The only treatment available to me back then, and still exists today, was a whole lung lavage, which can be complicated if it's never done before. It was 12 years and a lot of travel before finding my doctor that had performed a lot of these lavages in his career, and he was located in Colorado. And also I was introduced to the first PAP patient that I had ever known or talked to before. So that was a huge revelation for me to actually talk to someone else who had what I had. And by this time, an off-label drug, GM-CSF, was introduced to our community, and that was showing results in some where they went into remission. So I traveled a lot to find treatment and doctors, and I still do. I also have a legacy to withhold. As a fighter, my dad was a boxer in the Army in the 40s, actually, Golden Gloves they called it. I still fight, and I continue to fight for myself, and I fight for others also. So my story never had remission in it, unfortunately. After my continual decline due to subsequent fibrosis and bronchiectasis, I had multiple infections and pneumonias, and eventually required the use of oxygen. I was one of the rare that would require a lung transplant to continue on with living. I received this life-saving donor double lung transplant in 2016, and I have my life back now. I can talk freely. Autoimmune PAP was detected 1 year later in my new lungs via CAT scan and the blood test I mentioned earlier. Although I have a new normal of anti-rejection and PAP meds, I can be as active as I want to since I feel I've got my secret punch this time. So I play tennis, I kayak in the waters I live on, I travel to the west and I go hiking again, and I have another trip planned. I most certainly have a survivor's tale that's had its dark moments. But I see the light now, and I continue on as a patient and ambassador for PAP and anyone who wants to talk. So thank you for listening. I feel there's hope. Hang on.